She's done a ton of work in the U.S. Attorney's Office for the Southern District of Ohio. You probably have seen her on. Mehek Cooke with us now, Senior National Security and Legal Analyst for the Daily Signal. Mehek Cooke with us now, Senior National Security and Legal Analyst for the Daily Signal. She's done a ton of work in the U.S. Attorney's Office for the Southern District of Ohio. You probably have seen her on television a decent amount. And let's kind of dive right in off the top here. The Ohio fraud story. You worked on this. Some of the numbers coming out on it are unbelievable. What should we know about that investigation, and how commonplace at this point should we consider healthcare fraud like this to be if it's taking place in a red state like Ohio too?
Clay, thank you so much for having me on. Look, this was the tip of the spear. When you saw in Minnesota what was happening, I immediately knew anytime you have a welfare program, there's going to be fraud because government is so complacent. Let me tell you, in Ohio, back in December, I started knocking on doors and asking home health care questions, the same place that the Daily Wire went, and I uncovered millions of dollars of fraud. Whistleblowers were coming to me. These are people in the industry, doctors, that were being forced to rubber stamp paperwork for the Somalian, Bhutanese, and Nepali community, all saying, we want home health care services. So it's hidden, right? It's behind a door. You don't really know what's happening, but most of these patients never needed home health care. So the doctor said no. So they started threatening them. They started pushing for other doctors to rubber stamp it. I'm going to give you a statistic that's going to shock you right now. Ohio has spent $1.6 billion in home health care. Franklin County alone, Columbus, Ohio, largest Somalian population next to Minnesota, where I live, alone accounts for 38% of that, which is about 6.8 million. Two zip codes, again, where I live, two zip codes account for, out of that 608 million, 40% of that. So it's about $283 million. At some point, the state of Ohio has to say, what's going on in these two zip codes, mostly owned by the Somali, Bhutanese, and Nepalese community, but they didn't. Our governor came out and said it's the cost of doing business. So we're going to see people like J.D. Vance actually coming in to save our tax dollars because our government refuses to do that.
Hey, Mehek, it's Buck, and thank you for joining us here. You're talking about the scale of what seems to be a very broad, apparent fraud going on, a systematic fraud, systemic and systematic, enforcement against this. J.D. Vance has been tasked to do this, but that's going to take some time. Financial crimes, in particular on the federal side, can be somewhat long in terms of the start of the investigation to the actual bringing of charges. Why haven't we seen more deterrence prosecution of this in Ohio? It would feel like this is pretty easy. This would be low-hanging fruit for some AUSA to say you're completely ripping off the taxpayer, you're defrauding the American government, and this has got to stop. Why aren't they doing that?
Buck, it's such an easy question, but this is a loaded question. It's because a U.S. Attorney's Office or any prosecutor actually needs the evidence. I've spoken to the U.S. Attorney's Office. I used to work down the street, and they're looking for evidence of fraud. So that lands squarely with the governor's office and the attorney general, the same places that whistleblowers have gone and said there is fraud happening. The governor's office, since January 15th, his agency has refused to give us the amount of dollars that we're even giving to these home health care systems. So when you knock on doors, most of these people are in the Somalian community. They don't speak English. So I'm wondering how they're even providing services. But the governor's office is not giving information. The only state official in Ohio that's actually looking into this is our auditor, Keith Faber. Let me tell you something. He has also asked for information, and the governor's office and his agency is slowly trickling that information. So audits take a lot of time. It's hard to understand what type of fraud is actually happening and how much, but all you need is to knock on a door to realize they're not providing home health care services. They don't even speak English. People are complacent in the state of Ohio and so many other agencies because this isn't their tax dollars. I mean, it's ours. They're just rubber stamping it. They don't care about Ohioans. They don't care about Americans. They want to just continue to funnel money out the door as long as they're paid. That's the problem in America today.